Good afternoon to all of you. Happy Friday to everyone. I think we have a lot of participants already in the call. Okay, so we are happy to welcome you on our second webinar for 2022. I am Jo Crescel Sanico, the Head of Internal Audit of Generali Philippines, and I will be your host for today's webinar. So March 15 marked the second year of the worldwide lockdown due to COVID-19 pandemic. In the Philippines, around 58.50% of the population have been fully vaccinated after 2 years into the pandemic. With the continuous decrease in reported COVID-19 cases, the Philippine government is currently allowing establishments and public transportation to fully operate with no restrictions. Offices, schools, restaurants, cinemas, and even stores are slowly opening to the public. Philippines is targeting this year to transition businesses to a hybrid work setup, which is a mix of working at home and at the office. And then the pandemic pushed businesses to operate in a work from home setup for the last 2 years. The government has released an announcement mandating the BPO industry to be fully operational in their offices by April 1, which is today. Employers and employees are uncertain of the new normal workplace setup. Not only do employees worry about going through traffic and changing their work setup, but also risking their health when reporting to work face-to-face. So as we welcome back our employees to the office, how do we keep them safe and productive in the middle of the pandemic? So this webinar is in cooperation with Home Healthcare, a premium provider of health and wellness programs. So we have a few reminders before we start our program. So we will put everyone on mute mode so that we can hear our speaker clearly during her talking segment. So if you want to engage with us, just send a message through the chat box, which is below your screen. And also feel free to write down your questions for our speaker. So the live Q&A box is open throughout the talk, and you can type your listed question or questions there, and we will do our best to answer it during the Q&A segment. So without further ado, we can now begin our program. So let me introduce our speaker. So our speaker for today is a graduate of medicine from the University of the Philippines. She obtained her fellowship on infectious and tropical disease in pediatric in UP Philippine General Hospital, and she also served as an associate editor of Philippine Journal of Pediatrics and is a former co-chair of Ways and Means Committee of the Philippine Pediatric Society Annual Convention and the chair of Committee on Handbook of Pediatric Infectious Disease. So currently, she is a professor in College of Medicine at the University of the Philippines and also the chief of Infection and Tropical Disease Division of the UP Philippine General Hospital, or UPPGH. Moreover, she is a member of the DOH Technical Advisory Group on COVID-19. So let us welcome on your screen Dr. Ana Lisa Ong Lee.
Thank you, Jo, for the kind introduction, and good afternoon to the Generali team members. Magandang hapon po sa ating lahat, and thank you for joining us in this webinar where we'll be talking about some things we can do to ensure our safety as we start transitioning to a new work setup. So let me just get my slides online. Okay, so I've been asked to talk to you about going back to the office in a pandemic setting. And to be able to answer that question, we need to understand the current context and understand the basic principles of disease transmission so that we can figure out how we can best resume our activities safely. So this is not just in the context of the workplace, but even in our day-to-day activities where we have more and more mobility being allowed and therefore more and more contacts from outside our home. And I guess the main goal really is to be able to make an awareness of COVID transmission such a ingrained part of our way of thinking so that we are able to maximally implement all of these safety measures without even giving it a second thought. So these numbers come from the World Health Organization. And even if we note that in the country, we have decreased number of cases and deaths very significantly over the past 2 months, I'm sure you're also aware that there are many other countries in the world that are continuing to deal with increasing cases of COVID. So the daily additional numbers reach about more than 1 million, no, on a daily basis. So medyo magugulat tayo niyan kasi dito sa Pilipinas parang halos wala na tayong naririnig or nababalita ang mga kaso. And yet in countries like Hong Kong, South Korea, some countries in Europe, marami pa rin nagkakasakit. Unfortunately, these numbers have also brought in a significant number of deaths, now counting 6 million. Ang Pilipinas, base dito sa map, you'll see that we actually have a fair number of cases, no? Not as few as other paler numbers in the graph, but I think we've done a fairly good job considering the limited healthcare infrastructure that we have. So we now have 3.6 million or so cases, of which we have had almost 60,000 deaths. And even as I mentioned, currently mababa ang mga kaso natin, alam din natin na nagmula pa lamang tayo sa isang surge that happened in January and was preceded by another surge in September. At that time, the circulating variant was Delta. Alam natin na talagang ang daming nahirapan noong mga panahon na yan kasi magkasakit ka nga, hindi ka pa makapagpa-ospital kasi walang mapuntahan. And kahit nasa ospital ka na, hindi ka necessarily sure na maaasikaso ka kasi sa dami ng kaso. Typically, it takes about 2 or 3 months before our numbers go down. And in the same way, noong September tayo nagkaroon ng maraming kaso, by December medyo bumaba siya ng gusto. December usually brings a need, no, a desire for us to get together with our friends and family, and this year was no exception. Nagbibigay tayo ng warnings, no, in the healthcare sector na sana hindi masyadong magkumpul-kumpulan. Pero inaasahan na talaga natin na by January, nagkakaroon talaga ng uptick. After every holiday, ganyan talaga yan. Ang hindi maganda is that nung pagdami ng kaso or yung pagdami ng kaso that we expected to happen in January following the Christmas holidays also coincided with the identification of the Omicron variant. And this really drove the numbers of cases up to more than 200,000 on a week-to-week basis. And alam naman natin kung gano'ng karami ang mga taong nagkasakit. I'm sure marami sa inyo nahawaan din at hindi lamang kayo, kundi pati ang mga pamilya at kamag-anak pa ninyo. If we look at the distribution of cases, you will see that the majority of cases are really clustered in the working population. So, kayo ito, no? Nagtatrabaho, tayo ito, na mga nagtatrabaho, lumalabas ng bahay, we run our essential errands for the households. And dahil marami tayong contacts, we interact with so many other people, it's not surprising that we are exposed and we get infected. Awa na lang ng Diyos, no, karamihan ng mga deaths ay hindi nandito sa age group na ito, kundi dun sa medyo elderly at yung mga may comorbidities. No? Although, of course, we want to make sure that we can keep these numbers down as much as possible. In contrast, ang mga bata, no, dito sa 0 to 19-year-old age range make up about 11% of cases and 2.1% of the deaths. The global databases also maintain a Stringency Index, which is a compilation of response indicators including school closures, workplace closures, travel bans, and compared across different countries. Now, you will see that the Philippines is about medyo dark orange, no? So about this area. And we are scored at 78.2% with 100 being the strictest. So titignan natin dito sa mapang to, yung mga pula ang pinaka-strict. Tapos the lighter colors, of course, are the least strict. And you will see that many of the countries in Asia actually took a very conservative approach. Marami tayong mga lockdowns and movement restrictions na naging maganda naman kasi nakabawas talaga dun sa dami ng kaso. compared to if you will look at North America or Europe, where the colors are very light, meaning their stringency index is quite low. This is what the stringency index looked like over time, mula nung January 2020 until currently in March 2022. So pag mataas ang level, ibig sabihin na kapag lockdown tayo, medyo bumaba lang ng konti. Nung nagsimula yung January dahil napakababa ng kaso, and then dumami na naman or tumaas na naman ulit ang ating movement restrictions nung dumami ang kaso during Omicron. You will see that the stringency is actually actually mirrors the number of cases that's being seen in the country, and understandable naman ito. Pagka maraming kaso, syempre, aasahan natin na magkakaroon ng movement restrictions. This particular graph shows us the lockdown recommendations or closure recommendations as applied particularly to the work setting. Makikita ninyo na halos orange or red, no? And I'm sure you know na matagal din bago pinayagan ng face-to-face, even just partial face-to-face return to work, no? So nito na nga lang sinabi na kailangan bumalik na sa face-to-face work ang ating specific industries, no? Dahil inaasahan naman natin na kaya nating makontrol yung dami ng kaso. So, marami nagsasabi na hindi maganda ang ginawa ng Pilipinas. Tayo yata yung bansa na pinakamahaba ang lockdown throughout the world. But you will see that if we look at infections and deaths as a trade-off, mababa ang ating rates of infection when compared to Asia and the Middle East and even globally. Of course, our deaths are quite low. No? Our death rate is quite low, and this is very commendable considering the limitations in resources that we have being a developing country setting. So, looking now at this table, alam natin na nandito na tayo sa alert level 1 where most workplaces are already, most public settings are already at 100% capacity. Many institutions are fully operational. Nabanggit na kanina ni John, may sine na, pwede nang manood, pwede nang lumabas, pwede nang bumiyahe. And syempre, ang kapalit nito with more mobility means more opportunities for infection. So, paano natin ngayon ima-manage ang ating kilos sa pang-araw-araw to make sure that we resume our activities safely? Ang sagot dito is kailangan natin kilalanin kung ano ba tong kalaban natin. How is this virus actually transmitted? I'm sure alam na natin lahat, no? There are two main ways by which this virus gets spread around. First is by droplet, second is by aerosol. So anong ibig sabihin ng droplet? Ito yung medyo malalaking particles. Pagka may bumahing o umubo na tumitilamsik, nakikita natin yan. Yun ang tinatawag nating droplets. And dahil malalaki yan, sandali lang silang lumulutang sa hangin, babagsak ka agad. So kung nagkataon, nakaharap mo yung umupo or bumahing, or nandun ka sa paligid niya, pwedeng dapuan ka ng kanyang mga droplets, pwedeng dumihan ng kamay mo, no? And pwedeng mailipat mo yan sa iyong mata, ilong at bibig, pwedeng pumasok yung virus. So yun, paano natin yan iiwasan? Siyempre, marami tayong strategies. Paano naman ngayon yung maliliit na particles or the aerosols that can stay in the air and float for a longer time? Meron din tayo dapat maisip na strategies para kalabanin itong mga lumulutang-lutang na to na may bitbit na viruses. So, ang strategies na kailangan natin isipin are still the very basic things that we have been reminded of from the start. Bago pa kasi tayo dapat umalis ng bahay, siguraduhin muna natin na wala tayong nararamdaman or hindi masama ang ating pakiramdam. No? So, let's remember that in the past, no, dahil wala pa namang COVID nung panahon na yon, kung nagkakaroon tayo ng konting sakit ng katawan, konting ubo, konting sipon, alam natin na hindi ikakaperwisyo nung mahahawaan natin ng ubot sipon yung binibitbit nating virus. Kasi ano ba naman ang ubot sipon? Ang dali lang naman gumaling. Pero syempre, ayaw pa rin nating manghawa. But it wasn't a reason to stay home. Ngayon, iba na ang usapan. Pagka may nararamdaman, dapat nasa bahay, dapat nag-isolate, dapat naghahanap ng paraan muna bago magpa-test, bago mag-resume ng normal activities. Kasi ang kapalit nun, kung nagkataon na COVID pala ang bitbit natin, hindi lang tayo naging danger para sa ating mga kasama sa bahay, magiging problema din tayo ng ating mga workplace contacts, lalo na kung natuklasan, eventually, na positibo pala tayo at na-expose na natin sila. So I think this is really a huge paradigm shift. Kasi dati, di ba, tandaan natin, kulang na lang na ma-hospital ka na, basta kailangan kong igapang to at papasok ako ng trabaho. Ngayon, hindi na pwede yan. We should actually incentivize our colleagues, no, who are able to inform us early na meron silang nararamdamang hindi maganda sa katawan nila and they're opting to consult first before coming to the workplace. Siguro if I can share, no, medyo mahirap itong paradigm shift na to, lalo na sa healthcare workers. Kasi we are very conscious, no, of every person who misses work, and pagka nawala ka sa trabaho, syempre ang laki nung burden na iiwan mo sa iyong mga kasamahan. So, mahirap nung simula ipaintindi sa mga tao na okay lang, wag kang pumasok kung may sakit ka kasi ang kapalit naman nun is maaring may mahawa ang iba, no? So, this is something that needs to engenders a paradigm shift and a shift in mindset that the teams need to encourage so that we minimize contact between people who happen to be incubating the illness already. Now, hindi lang kung may nararamdaman ka, kung meron kang kasama sa bahay na nagkasakit, no? Dapat din magdalawang isip kung papasok ka pa rin ba. Kasi maaring pati ikaw ay nahawaan na at pwede ka na rin manghawa. Next is, if you check yourself and you find that you're okay for the day and you're ready to go to work, paano mo naman i-manage yung daily commute mo? Maganda't maganda kung meron kang sariling sasakyan at ikaw ang nagmamaneho, hindi ka na-expose sa driver, pero karamihan sa atin, kailangan mag-public or kailangan mag-commute or kailangan mag-carpool. So, kailangan tandaan natin na anything na kulob, pwedeng bahaya ng mikrobyo, pwedeng bahaya ng virus, pwedeng malanghap natin yung virus at mahawaan tayo. So the key to safe commuting is making sure that the vehicle you're riding in is well ventilated. So if it's a car, a bus, or some other kind of four-wheeled vehicle, ang importante is dapat nakabukas sa mga bintana. So intuitively, alin pang bintana ang binubuksan natin? Siyempre yung nasa tabi natin, di ba? Kasi yun ang madaling i-access. Pero sinasabi ng diagram na ito na mali. Dapat yung katapat natin ang nakabukas. So tulad nitong figure na ito, you will see that the rear seat passenger opens the window across him, and the same way the driver does the same thing. Kasi ang gusto nating mangyari is that direct natin yung airflow such that yung fresh air is the one that is is what we are encountering. Hindi yung nahingahan na nung kasama natin sa sakyan. Siyempre, ang pinakamaganda pa rin, bukas lahat ng bintana. Pero minsan kung umuulan o mainit or medyo natatakot tayo dun sa possibility na medyo maging dangerous yung commute, ayaw natin bukas na bukas yung bintana. So kahit kaunti lang, pwede na rin yan. Mga 2-3 inches should be enough. And then again, kung saan mo bubuksan, it also makes a difference. So, nakaalis ka ng bahay kasi wala kang sakit, nakasakay ka ng maayos kasi inintindi mo yung ventilation, and of course, nakamask ka at hanggat maaari ay nag-physical distance ka. Pagdating naman sa opisina, ano naman ang dapat mong isipin? Ang pinakamahalagang pwedeng gawin ng isang workplace to ensure the safety of its workers is to make sure that the ventilation systems are well managed. So, karamihan, nagtatrabaho sa mga building na hindi pwede buksan ng bintana. So for air-conditioned spaces with mechanical ventilation provision like office buildings and shopping malls, you have to ensure that ventilation systems are in good working order, that there is maximal fresh air intake, that before occupancy every day, kailangan na purge yung indoor air. So napapasingaw muna siguro yung kulob na hangin. You have to reduce indoor air circulation. So dapat maganda ang ventilation and flow. And huwag nating kalimutan na yung mga toilets, pwede yung pagmula ng pagsingaw ng mga mikrobyo, not necessarily just COVID, and the exhaust fans need to keep running. Kung sakasakali naman na split unit air conditioners ang ginagamit sa ating mga opisina, so hindi siya centralized, malamang may access sa bintana, pwedeng iwanang bukas ang bintana ng bahagya or you open it frequently. Pwede siguro tayong mag-assign ng times of the day na nakabukas ang bintana para ma-encourage ang airflow. Think about putting in window-mounted fan systems para may exhaust. And you also need to make sure that the toilets are also well ventilated. Finally, in open air settings with natural vents, other settings, ang recommendation talaga is to keep your windows and doors open. Kung may magagamit na fan, nakatutok palabas para maganda ang flow ng hangin. And once again, exhaust systems in the premises and also in the toilets para yun namang nakukulog na mikrobyo doon sa mga toilets ay namamanage natin. Now, we're not really very familiar with air quality monitoring in our country, pero may silbi na ngayon ang pag-reference sa mga numbers. Kasi meron naman talagang standards na sinusunod. So actually, outdoor air, or rather, we actually monitor carbon dioxide levels as a surrogate, as a marker to find out whether nagsa-circulate ba yung hangin o hindi. Ang pinagmumulan lang naman nito kasi is kung kulob ang isang lugar, may mga tao sa loob, syempre, kung mas marami ang CO2 doon, ibig sabihin yung hinihinga natin palabas, hindi lumalabas ng kwarto. So, dapat sana 450 and below yung reading na makikita natin para masabing katulad ng outdoor yung air quality nung isang silid na yon. Pero, if we're talking about day-to-day activities, karaniwan for an office setting, tinatanggap na natin yung 800 ppms na reading. So, these monitors are really quite cheap. I would encourage actually every household to have one. And I actually have gone around in some of my errands bringing this with me just to find out what the air quality of some of the premises that I visit are. And minsan talaga ayaw mong huminga kasi nagre-read siya ng 1,600, 2,000. And kahit sinasabi mo, oy, how pleasant, malamig ang air conditioning dito. The temperature, low temperatures don't necessarily equate with good ventilation. So it's something to think about, something that the office settings might think about having. Maraming mga variations nito, they're quite affordable. And you want the ones that are labeled NDIA or non-dispersible ionizing something, Or maybe your building engineers will be able to assist you in finding these equipment. So, eto pa, some more ventilation tips now coming from the WHO. Contrasting kung ano ba yung good ventilation, better ventilation. And of course, sinasabi natin, the more windows and doors that you have open, the more fans you have, the better. Ang fan nakatutok palabas, hindi nakatutok sa atin, And kahit gumagamit ng air conditioning, mas maganda pa rin na kahit papano binubuksan ng madalas or paminsan-minsan rather yung mga windows and doors so that you have fresh air coming into the room. Nandito rin yung guidance tungkol sa using a fan, Again, nakatutok palabas. And then finally, yung sa sasakyan, sinasabi na when you're using your air conditioner in a vehicle, dapat yung fresh air setting ang nakabukas para nga may circulation na napapakinabangan. So, again, di ba? Nakalabas tayo ng bahay ng maayos kasi wala tayong nararamdamang masama. Sumakay tayo ng maayos sa ating public transport kasi pinansin natin yung ventilation, umiwas tayo sa crowded na time slot. Sana pumili tayo ng slot na medyo maaga-aga or a little late para hindi natin kasabayan ang lahat ng tao. Pumili tayo ng sasakyan na nakabukas ang bintana or nabuksan natin ng bahagya ang bintana. Nakapasok tayo sa opisinang maganda na ang ventilation kasi inisip na ng building management na optimize yung setup ano naman ang kaya nating gawin for ourselves. The last step is really to make sure na tayo ay parating nakamask. Ito naman ang kaya nating makontrol and nasa sa atin na ang pagsunod dito. We need to make sure that we choose a good mask with good fit and good filtration capacity. Kasi kahit naman ano pang N yan, kahit N95, 98, 97, if there is such a thing, kung maluwag at may puwang sa mga gilid, that's useless. Kasi malulusutan ka pa rin ng virus. So importante, hindi lang yung filtration capacity kung hindi yung fit. Kaya inire-recommend yung double layering kasi with double layering, kung cloth mask mo can have as low as 10% filtration and your surgical mask can only be 60 to 70% kasi may puwang sa gilid. Pag pinagsabay mo yan, then ma-achieve mo yung higher rates of protection kasi maganda ang fit niya at maganda ang filtration. So hindi lang naman ito ang paraan na pwedeng gamitin. You can also use a well-fitting your KN95 or N95 mask or KN94 masks that fit your face contour very well. And the test really is that when you breathe, dapat medyo nagko-collapse ng konti yung mask kasi that means may vacuum, no? Which is what you want. So numerous studies have shown that you can actually decrease the rates of infection by 95% if you use well-fitting masks and you use it consistently. So tama nga ang fit, maganda nga ang filtration capacity, pero kung madalas naman natin tinatanggal or hindi natin sinusuot ng tama, malulusutan pa rin tayo. Maraming mga pagkakataon no, na nababalitaan natin na nagkakaroon ng infection ang healthcare workers. But actually, I have to say, no, I have to correct myself and say madalang nga ito. Kasi kung humaharap kami sa pasyente, todo balot, naka-mask, naka-shield, naka-PPE at lahat. Kaya maliit ang chance na kami ay malusutan. Kailan ba nagkakahawaan ang mga healthcare workers? Unfortunately, this is during meal breaks and rest periods where sometimes the masks are taken off. And of course, when we engage each other no, at wala tayong mask, pwedeng magkahawaan. So let's learn the lesson from the healthcare worker setup. For as long as you're wearing a mask, kahit ang kaharap mo ay may sakit, mababa ang chance na mahawaan ka. So dapat ganoon din in any other workplace to decrease our risks of catching this disease. No? So kung sakasakalit consistent tayo sa pagsuot ng ating mask at maayos ang pagsusuot natin ng mask, mababa ang chance na mahawaan tayo. Finally, and I don't want to leave this topic without talking a little bit about vaccines, no? Lahat naman ng mga ginagawa natin, tulong-tulong yan. No? So these are Swiss cheese layers of protection para kahit may butas, pwedeng may panangga yung susunod na layer. And of course, vaccines no, are a very important advance na nakatulong talaga sa pag-iwas ng sakit. Right now, we have about 240 million doses in the country. This is the number. 180 million or so have already been deployed all over the country. So hawak na yan ng mga vaccination centers. Pero ang tumatanggap pa lamang ay 140 million. So meron pa tayong napakarami, almost 100 million doses na nag-aantay pang maiturok sa ating mga pasyente. Ilan ba tayo? We are 110 million people. Dapat ngayon, karamihan sa atin ay nakadalawang dosis na at dapat marami din sa atin ay boosted already. So ano na ba ang ating sitwasyon? You belong to the 18 to 59-year-old age range. A lot of people have received at least one dose. Many have been fully vaccinated but very low numbers are boosted. So maybe if I will ask later, sino na ba sa inyo nagpa-boost? Baka malungkot tayo para malaman na marami pa palang kailangan na magpa-boost, no? So we need all of these layers of protection. I hope many of our family members have already been vaccinated so that we can maximize, no, the protection that we can get from all of these different interventions. So I started off this talk by asking two questions. Where are we now? No, we are blessed to be in a setting where the numbers are really very, very low. We hope this continues. It's very difficult to say kung ito na ba talaga ang katapusan ng COVID, no? But even so, no, dumami siya or hindi, for so long as we understand how this virus is transmitted, we will know how to resume our activities safely. And focusing on important aspects like wearing our mask consistently, staying in well-ventilated places, and making sure that we are vaccinated and boosted will make a huge difference. So with that, let me thank you for your attention and turn the floor back to our moderator.
Thank you, Dr. Anya. So I hope everyone learned a lot from this session. Can I get an exclamation point from the attendees if may natutunan nga kayo on how can we best resume to our workplace safely? Ayan. So meron tayong na-receive na exclamation points. Tama yan. So indeed, marami nga tayong natutunan. So my key takeaways from this session. So if you are feeling sick, just stay at home. Or kung nasa building na po kayo, better to leave the building and contact your healthcare provider and inform your supervisors also na meron pala kayong nararamdaman. And if you are a commuter, so it is better to take or ride the vehicles with well-ventilated and then iwasan din natin yung crowd places. Then sa offices din natin or sa establishments natin, let's check then if we have a good working ventilation. And make sure then that we use or wear masks that fits properly to our faces with better filtration capacity. So sabi nga ni Doc, mas maganda din yung double mask para better air filtration yung capacity niya. Also, we encourage everyone to get vaccinated for additional layer of protection. Okay, so and now we are activating the live Q&A box to accommodate your questions for our guest speaker. So please write down your questions in the box, so found at the bottom part of your screens. Okay, so let me read the question. So first question, if you have been exposed to a colleague who tested positive, how long should you quarantine before reporting to work again?
I hope we will be able to say hindi ka kailangan mag-quarantine. Bakit? Kasi kung the only exposure that you have to that coworker is mass encounters in a room that is well ventilated, hindi ka i-consider as close contact. Therefore, hindi ka kailangan mag-quarantine. Lalo na kung bakunado ka. So we want to be in a setting like that Hindi na natin kailangan pag-isipin na tayo magka-quarantine for other contacts other than our home. Siyempre kasi sa bahay, di naman tayo magmamask, di ba? So definitely, kung may magkasakit doon, close contact tayo ng taong yun. Pero sa labas, dapat hindi tayo ever in a situation where we are caught without our masks on. And only in that setting will you be able to say na close contact ka at kailangan mo mag-quarantine. So, sabihin na lang natin, hindi kasi nagsama nga kaming kumain nag-birthday, ganun, or whatever. So finally, sige na nga, close contact ka na. Ka-quarantine ka ba? Ngayon, kung ikaw ay bakunado at boosted, the current recommendation is quarantine of 5 days. And then, if you don't have any symptoms, self-monitoring na lang. No? So, ibig sabihin, after the 5th day, pwede ka nang bumalik sa work. Again, syempre, nakamask ka kasi binabantayan mo pa all the way to 14 days yan. Kasi pwede ka pa rin namang lusutan or magkaroon ng sintomas. Kaya lang natin pinaiksi yung quarantine ngayon kasi karaniwan kung Omicron to, mabilis lumabas yung sintomas. Typically within 5 days, kung talagang na-expose ka, magkakasintomas ka na. Kaya doon ka binabantayan. Pero that's not to say na yung remaining 6, 7, 8, 9, 10, all the way to 14, ay hindi ka pa pwede magkaroon ng sintomas. Pwede pa rin yun. Saka hindi lang naman Omicron na umiikot, meron pa namang iba.
Thank you, Doc, for answering that question. So at least 5 days, no, kung talagang close contact and if you feel na may symptoms ka.
Well,
So,
quarantine is no
quarantine.
symptoms, Jo, di ba? So ang babalikan natin dapat talaga, syempre kung may sintomas, ibang kwento na to. Pero kung wala, dapat ang kaya nating isagot sa sarili natin, hindi ako close contact kasi di ako nagtanggal ng mask eh. Diba? So dapat ganun parati ang kaya nating isagot. Kung hindi natin yung kaya isagot, kailangan mag-reevaluate tayo kasi hindi tayo careful. Diba?
Agree daw.
Uwi tayo ng sakit sa bahay. So dapat walang puwang na makalusot ang sakit sa atin.
Agree daw. Okay, so second question, Doc, in terms of infectious rate among employees, at what point should we temporarily stop full operations?
I think that will really be based on tolerance ng workplace eh. Kung siguro for me, no, what I would start to implement is ano ba ang nangyari dun sa circumstances before we say na kailangan na natin magsara, no? Siguro yung considerations is, eto ba ay just a small number of cases or kalat na sa lahat? Pag kalat na kasi sa lahat, wala ka na rin namang choice eh. Kung sunod-sunod na yung mga kaso, wala nang point na ipilit mong papasukin yung mga tao kasi sooner or later sila rin mahahawaan.
Mahahawaan. Tama, Doc.
So kung kunwari nakita natin that we're only talking about 1 or 2 people and then no other cases and then all the contacts that have been identified were consistent in wearing their mask, okay lang yon. Pero kung nakikita natin na nagka-cluster na siya, 2, 3, 4 people in short succession, tapos nung nag-contact trace tayo, nakita natin, ay naku, lahat pala
madami pala
ng isang party sa labas naman ng workplace, pero sabay-sabay silang pumunta. Ay naku, useless yon. Kahit pilitin mo magbukas, magkakalat lang kayo sa office, might as well, wag na muna magpapasok, magpagaling na muna lahat, tapos at saka na lang ulit bumalik. Pero very suggestive. Parang wala akong masasabi sa iyong number na o pag 5 na, hindi na pwede ha. Depende talaga sa circumstances.
Pero Doc, mas maganda po ba or mas maganda bang encourage natin yung companies natin na yung employees natin have them tested first before going to the office?
So usually binibring up yan, Jo, no, as a measure. Pero tandaan natin, unang-una, syempre ayaw siguro natin ng PCR-based testing kasi ang mahal-mahal, tapos ang tagal pa makuha yung resulta. So malamang ang mangyayari niyan, mag-antigen test ka, self-administered. Ano nga ba ang pick-up rate ng antigen test kung asymptomatic ka at hindi ka man lang close contact? Napakababa. So,
mababa nga siya.
Wala siyang masyadong advantage. Kung may nahuli kang positive, tsambahan lang yon. Hindi dahil magaling yung test, natsambahan ka lang na incubating ka na talaga at malamang na-expose ka sa bahay kasi doon ka lang naman hindi nagmamask, diba? So the pickup rate is quite low. So that's the sensitivity. And really in comparison to symptom screening and a good history, halos magkatulad lang yan. So mas wala ka pang gastos dun sa symptom screening at a good history, diba?
Agree, Doc. Meron po bang immunity period yung mga patients or individuals after being COVID positive?
Well, sinasabi na medyo mas mababa yung risk mo ng infection for about 90 days post-illness, no? Pero that's very variable kasi depende dun sa severity ng illness na nakuha mo, kung anong klaseng variant yung naging infection mo, no? And ngayon, with more and more people being vaccinated, pwede ngang longer than that eh. Kasi kung bakunado ka na, tapos nasingitan ka ng Omicron, kasi ang dami naman sa atin nagkaganon eh, di ba? Nagkasakit din. Sa ngayon siguro kung magpa-antibody test ka, ang taas-taas ng levels mo. So malamang mas matagal ka pang protected. But again, that's very variable. No? So we cannot use previous illness as a guarantee to say, ay hindi na ako magkakasakit, tatamaan na ako ng dati. Walang ganon for COVID.
For COVID.
Walang ganon.
Pero Doc, kung halimbawa, di ba nag-positive ka na, tas you feel na you're okay na, is it recommended ba to get yourself tested again before returning to office?
Hindi na kailangan, no? Kasi kung PCR ang gagamitin mo, pwedeng matagal na mag-positive yan pero hindi ka na nakakahawa. Kung antigen naman ang gagamitin mong test, well, again, the sensitivity or the pickup rate is quite variable. So it's very difficult to rely on a negative test as a clearance for allowing you to go back to work. Mas simple pa yung mag-antay ka na lang ng 10 araw, pag nakumpleto mo na yon, no, 10 days from the onset of symptoms or 10 days from a positive test, whichever comes first, already allows you to resume your regular activities.
Okay. We have question here related to UV care or air purifiers. So it says daw instantly kill SARS-CoV-2. Is it really effective po ba, Doc?
Tandaan natin na yung ating goal, no, is actually to improve ventilation. Ginagamit lang natin yung mga filters and other devices kung hindi natin ma-maximize yung paggamit ng fresh and flowing air. So tulad niya, no, mag-claim na yung device, pagka may UV light siya, mapapatay na yung mikrobyo. Pero hindi nga, ba't kung maganda yung ventilation mo, wala ka ng mikrobyo dun sa hangin? So ano pang kailangan mo dun?
So better po talaga, Doc, na mas maganda yung air ventilation.
May gamit siya. No? I'm not saying they're totally useless, but if it's an option to have good ventilation, that is superior to anything else that can be offered.
Doc, ano po yung pangalan ulit ng instrument that measures carbon dioxide?
CO2 meter.
CO2 meter.
Marami yung carbon dioxide meters sa mga online stores, ang dami-dami.
Okay, so I think we almost answered all the questions. So may questions pa ba from the participants? Okay. Ayan, on booster shot. Is there some sort of brand compatibility to the first and second doses vaccines?
Well, syempre, nire-recommend talaga natin na yung first and second doses natin should be the same brand, no? Hanggat maaari, hindi tayo nag-mix and match dun sa primary series natin kasi wala naman talagang data na nagsusupport na magandang gawain yan. Yung iba lang kasi napilitan kasi hindi available yung second dose nila, hindi na nagkaroon. Like yung mga nagpa-vaccinate ng Sputnik, hindi na nasundan yung second dose nila eh. So no choice.
So naghalo na sila talaga ng ibang ano.
Oo. Yung iba naman, for whatever reason, they choose to get another brand. Sige na, nandyan na yan eh. Ang may beginning evidence now is heterologous boosting, meaning after a 2-dose primary series from one brand, nag-cross-platform ka to have another booster. May starting evidence na yan. And it seems like mukhang mas magandang consideration yon na let's say you start off with an inactivated vaccine, then you cross-platform to viral vector or mRNA. So alam naman natin itong mga to, di ba? We're very well educated about the vaccine platforms. Yung inactivated, si Sinovac, Sinopharm, tapos yung mRNA, si Pfizer, Moderna, viral vector, si Janssen and AZ. No? So, yung dun sa mga pinaka-basic na primary series, like your inactivated, pag mag-cross ka to either mRNA or viral vector, mukhang maganda. Pagka mRNA na yung pinagmulan mo, mas maraming data na nagsasabi na gamitin mo na lang yung mRNA o kung magko-cross ka, hindi ka inactivated, gagamitin mo AZ o yung mga viral vector or mRNA ka rin. So, parang doon sa advanced platforms, you go higher. So, ganun din doon sa mga viral vector. But that's about the data we have, no? Pero to cross platforms with the first 2 doses, not recommended.
Hindi siya advisable. Okay po, Doc. And then, ano po yung ma-recommend yun na vitamins for employees to keep them healthy?
Kain lang ng maayos, no? Hindi naman kailangan ng
exercise, Doc.
Oo, very basic, no? Siguro ito na lang, kung kunwari meron kang dietary restrictions, bawal kang kumain ng ganito or hindi ka makakain ng ganyan, ito siguro yun yung may rule na pwede kang mag-supplement. Tapos siguro kung meron kang mga baseline illnesses na hindi ka talaga hindi ka makakain ng maayos, so you can take your supplements. Any multivitamins should actually do, no? Para supplyan ka nung daily requirements lang naman ang kailangan natin, hindi naman natin kailangan ng sobrang dami.
Okay, Doc. Doc, may follow-up questions pala tayo regarding vaccine. Is it dangerous daw ba to get too much vaccines? Kasi diba, sometimes nagpa-flu ka na, nagpa-COVID-19 ka pa, sobrang dami mo nang natitake na vaccine. Is it dangerous or safe naman po?
Yung mga bakunang ginagamit natin ngayon that are part of the regular recommendations have been tested naman. And kung sinasabi natin may overdose ba, so to speak, no? Is there such a thing as too many vaccines? Alam nyo kung iisipin natin right now where we're sitting, diba? While we're sitting listening to this talk, gaano kaya karaming mikrobyo ang nakakasalubong ng katawan natin? Diba? Hindi
Araw-araw.
lang siguro hundreds yan, baka thousands pa na lumulutang-lutang sa hangin, dun sa laptop na hinahawakan natin, sa mesa, sa kung saan-saan. And yet our bodies are able to cope. So parang ganun lang din naman yung bakuna. Oo. So kung intact yung immune system natin, kaya natin yung kalabanin. So kaya lang tayo nag-i-emphasize na, kailangan natin ng specific protection for these bugs like COVID or flu or pneumococcal pneumonia. It's because nakikita natin na ang taas ng rates, nagiging source siya ng severe disease, hospitalization, and death. At kung may paraan naman tayong umiwas, ba't naman hindi, di ba? So we take up the vaccines that are recommended for our age group and risk category because those have studies to prove that they're safe and effective.
Okay, Doc. Since, Doc, halimbawa, Doc, nagpa-booster ka na, no? Possible ba na eventually magpa-booster ulit or required ulit for boosters? Like parang annual shot siya dapat? Meron ba kayong possibility na mag-ganon?
Yeah. So lately, no, may mga naririnig-rinig na tayong parang exploring the option of dose 4, no? Pero pansinin ninyo, 'di ba, nung nagsimula lahat, halos unanimous yung recommendation for a 2-dose primary. Tapos, nung nagkaroon ng data showing susceptibility to Omicron, halos unanimous din yung recommendation for a booster. So, 2-dose primary plus a booster. Pero itong 4th dose, medyo parang mas maraming discussion going on, no? So, hindi siya unanimous recommendation.
Tsaka, Doc, po, nag-evolve din kasi ang variant ng COVID, no? So, sometimes
nag-evolve yung variants, nag-evolve din yung science, no? Kaya hindi din tayo ngayon kaagad-agad nagsasabi na hindi kailangan na natin ng dose 4. Kasi when you make these recommendations, you have to look at what's your goal. Is it prevention of infection? Alam naman natin, mahahawaan tayo, hindi naman yung problema eh. Ayaw lang natin mamatay pag nahawaan tayo. Kaya tayo nagpapabakuna. Sa totoo lang, kahit yung 2-dose schedule, mataas din ang rate ng protection against severe disease and death. Yung booster was really meant to control the speed of infection globally. Pero kahit with just 2 doses, okay tayo against severe disease. So lalo na ngayon, magbibigay tayo ng 4th dose. Kung sinasabi natin, protected na nga tayo ng 2 doses against severe disease and death, and yung dagdag na booster is extra na lang, ba't natin kailangan ng 4th dose? So doon nagsisentro ngayon yung discussion to justify the need really for dose 4 beyond special populations. Kasi yung mga immunocompromised, definitely magre-recommend tayo niyan. Yung mga seniors, malamang marerekomendan yan. Yung healthcare workers, tinitignan din kasi constant exposure. Pero for the general public, baka unahin muna natin yung booster 1 bago natin usapan yung booster 2.
Agree, Doc. May question here related sa, what if daw, di ba, ongoing yung vaccination mo or nasa period ka for vaccination for COVID, and then nakagat ka ng aso, tapos you need anti-rabies, kailan siya pwedeng administer doon sa patient?
Right away. No?
So hindi wala pong parang conflict yung components?
Wala. So siguro I'll clarify that, Jo. Kasi nababalitaan natin merong mga intervals na inire-recommend between receiving COVID vaccines and other vaccines. Yun ay in an elective setting, yung pwede mong schedule. And the reason for that is hindi tayo natatakot tayong magkukontrahan silang dalawa. In fact, in other countries, pinagsasabay nila yan. Yung flu, pneumococcal vaccine, COVID, sabay-sabayan sa isang sitting, walang problema.
Basta kaya po ng katawan.
Oo, kasi hindi sila magkukontrahan. Dito lang tayo sa Pilipinas naghiwa-hiwalay niyan kasi syempre marami tayong sensitivities about yung mga controversies sa pinagdaanan natin. Ayaw na natin ulit magkaroon ng mga ganung klaseng usapin. So sige na nga, paghiwalayin nyo na para wala nang bintangan kung saan nanggaling yung mga side effects na yan. Pero hindi dahil natatakot tayong magkontrahan sila. So therefore, kung meron kang emergency vaccine, di ka mag-aantay. Right away. Baka ikamatay mo pa yung rabies.
Dahil sa rabies. Diba? Agree. Okay, Doc. Last question here related sa, di ba po medyo tumataas ang cases ngayon sa Shanghai and Korea. Ano po kaya yung reasons nun kung bakit despite na yung campaign sa vaccination? And then ano po yung mga extra precaution that could happen here sa Philippines?
Yeah. So ano nga no, parang minsan isipin mo na lang ang bait-bait ni God. Kasi, kasi
Agree.
ang kumalat sa mundo was BA.1. For some reason tayo nagsimula tayo BA.2 kaagad. Actually, yung nanggaling sa mga travelers natin ay BA.1. Hindi na natin matrace kung saan nanggaling yung BA.2 na kumalat sa Pilipinas. So kaagad, BA.2 na tayo. Na-advanced na tayo. Yun yung kumakalat ngayon sa ibang bansa. Kaya sila nagkakagulo. So tayo tapos na. No? Tapos siguro, pwede ring sabihin na kahit papano nakatulong tong mga heterologous boost na natanggap natin. Kasi tandaan natin, di ba, na nagsimula, lungkot na lungkot tayo kasi ang sabi natin, inactivated vaccine lang yung nakuha natin kasi yun lang yung supply. Pero nagkataon dahil marami sa atin inactivated vaccine, syempre ang booster natin iba na. So heterologous boost ang marami sa population natin, maaaring nakatulong din yon. Tapos kahit ano pang sabihin natin tungkol dun sa face shield na yan, I'm sure nakatulong din yan, di ba? Sa maloob natin dati, pero I'm sure nakatulong din yan. So all of these things, no, they all play a little part of it. There are some countries na nakikita natin matataas ang rates kasi generally well vaccinated pero may special segments hindi. Like sa Hong Kong, yung elderly nila napakababa. Kaya doon sila nadali talaga. Kung titignan mo yung age distribution, dumami, pero ang talagang naperwisyo sa kanila napahamak yung mga adults. Sa South Korea, I'm not really very sure what's happening there no? Kasi we don't really have visibility about their different programs na medyo hindi rin nila gaanong napapublicize yun. Pero typically, it's a combination of vaccination coverage for their special populations and tolerance for the number of cases. Sa China naman, kasi ang kanilang is zero COVID policy. Syempre talagang tight lockdown sila kasi ang goal nila mag-zero.
Mag-zero.
Oo. So, syempre mas mababa ang tolerance nila for that. Ganun ang response nila.
Opo. Pero Doc, since 'di ba election period, so ang daming gatherings usually. So, na-forecast or na-foresee na tataas ulit yung cases natin after election?
Well, hindi na kailangan mag-intay pa ng after election, 'di ba? Ngayon pa lang sa bawat rally, bibilangin mo na lang yung 2 linggo eh. Kasi dadami na dapat yung kaso. Or hindi ka pa nga aabot sa 2 linggo kasi sabi natin kung Omicron yung umiikot,
dapat mas mabilis.
Dapat in 5 days time, nakarinig na tayo ng explosion of cases. Pero tahimik, di ba? So I have to say, we're really so blessed. Sobra ang tamang timing kasi kumalat siya bago pa pumasok yung election period. BA.2 na kaagad. Tapos ngayon, kahit nagkukumpul-kumpulan yung mga tao, hindi natin naririnig na nagkakaroon ng dami ng kaso. Pero ito na lang, let me just remind everybody. So unang-una, pag nagrarally, syempre dapat medyo assess yourself. Kung hindi maganda ang pakiramdam, wag nang pupunta. Una, hindi mo kakayanin sa dami ng tao at saka sa init ng panahon, hihimatayin ka talaga. Kahit wala kang nararamdaman nga, medyo pangit, di ba? Kasi it's really so crowded and it's so hot, ibang klase. Pangalawa, kung hindi ka bakunado, please, wag na. At hindi ka boosted, wag na. That's too much of a risk. Now, if you're vaccinated, you're boosted, you can tolerate the heat, and you're willing to wear your mask, okay, go. Pero, syempre, ingat pa rin, no? Hanggat maaari, yung kaya mong i-implement na minimum public health standards ay nagagawa mo dapat. Pero yung physical distancing is impossible. Dikit-dikit talaga mga tao.
Let's pray na lang and hope na hindi na tumaas ulit yung cases natin. Okay, so I think we have last question pero related naman to sa effectivity ng vaccine kasi Doc. Kasi sometimes 'di ba meron tayong patients na wala silang side effects like walang fever, headache or kung ano pang side effects. Does that mean ba na hindi daw effective yung vaccine sa kanila?
Hindi naman. No? May mga tao lang talagang medyo tolerant. Walang masyadong nararamdamang mga adverse events post-vax. So, nasa kanya-kanya na yung katawan. And many patients actually don't have a lot of post-vax effects.
Okay, so I think that ends our Q&A session. So we truly appreciate you, Dr. Anna, for giving us your time and sharing your knowledge on COVID-19 workplace readiness on a hybrid work setup. So before the webinar ends, we would like to know your feedback on this session. You may click on the chat box below to answer our survey. So please check na lang our chat box. And of course, we are still in the middle of the pandemic, so let us continue working together in fighting against COVID-19. Again, na-mention na kanina kung ano yung mga kailangan natin gawin. And then always wear your face mask, maintain social distancing. And lastly, be vaccinated against COVID-19. So on behalf of Generali Life Assurance Philippines, thank you for joining this webinar. And we look forward to seeing you again on our next webinars. So once again, I am Jo Crisel Sanico of Generali Philippines. Thank you for attending our webinar. Enjoy the rest of the Friday and have a happy weekend.